going to go through the test item cluster for thoracic spine manipulation that would benefit patients with neck pain. First off, they're going to have symptoms less than 30 days. They're going to have a reduced kyphosis in their thoracic spine or a flat back. If they look up, they're going to have less than 30 degrees in extension. Okay. They're also going to have no pain with extension. And they're going to score less than 12 on the FABQ activity subscale. And they're going to have no symptoms distal to the shoulder. For rotator cuff tears. So first off, you're going to follow me. We're going to do the painful arc. If there's pain right here, around 60 to 120, that's a positive sign for the painful arc. Then we're going to slowly lower your arms. If she can't control it, that's a positive sign for the drop arm test. And next we're going to do the infraspinatus, which she's going to hold her arms out like this. If she deviates inward without any resistance, that's a positive sign. Or if she can't hold this test position with resistance, that's a positive sign as well. For subacromial impingement, it has the same two items, the infraspinatus and the painful arc, as in the test item cluster for rotator cuff, but it also has the Hawkins-Kennedy. So we're going to hold her arm out like this. If there's pain with resistance here in her shoulder, that's a sign of impingement. Manipulation for patients with neck pain. They're going to have symptoms less than 38 days. They're going to have more than 10 degrees in side-to-side difference in rotation. So go ahead and look towards your right. Okay, look towards your left. Okay. The patient is also going to believe that it's going to work. And go ahead and lay down on your stomach for me. They're going to also have pain with PA modes. So I'm just applying pressure right here on the other side of the spinous process. Is there pain there?
Yeah.
Test item cluster for cervical radiculopathy. We'll start off with Sperling's. I'm just going to apply pressure down. We're looking for a recreation of your signs and symptoms. If there's no symptoms there, we go ahead and extend and press down. No symptoms there, we extend and rotate. Press down. For this, we stop whenever there are symptoms, and to alleviate them, we do the distraction. If pain is alleviated, that is a positive sign. And then we have less than 60 degrees ipsilateral rotation. So go ahead and look towards your left for me. Okay. And that's a positive sign. And then go ahead and lie on your back for me. We're going to do the upper limb neurotension test of the median nerve. So we're going to depress here. Bring your arm slowly into extension. We're looking for symptoms in her thumb. Tension test of the radial nerve. We're expecting symptoms along the back of the forearm and back of the hand for the radial nerve. So we're going to depress here, flex the wrist and fingers, and then slowly extend the arm. And she'll tell me when she feels symptoms. Right there? Okay. And then slowly come out of that. The cervical flexion rotation test. So I'm going to have her rotate her neck here to both sides. And then when I flex her neck all the way and do it again, I'm expecting about half as much rotation as she did before. And if it's less than half, we know there's an issue with C1 and C2 with rotation. Next, we're going to do the shoulder apprehension test. And we'll apply pressure onto her shoulder and take her arm into external rotation. And if there's any apprehension or muscle guarding in this motion, that's a sign of shoulder instability. The active compression test of the shoulder. So I'm going to have you bring your arms out like this. Back your hands together. I'm going to apply pressure down. Okay. Then thumbs up this time. Same thing, pressure down. And if pain is worse with thumbs down, that's a sign of superior labral issues or a slap lesion. Lift-off test. And it tests subscapularis. We're going to take the patient into this position, and then you're going to lift your hand off of your back. And if she can't do this, there's a sign of a subscap lesion. And then I can also test strength of the subscapularis here. Hold this, there you go. Differential diagnosis of a supraspinatus tear of the rotator cuff or a C6 radiculopathy. For a supraspinatus tear, she's going to have localized weakness and pain in the shoulder with external rotation and abduction. But with a C6 radiculopathy, she's going to have diffuse weakness down the arm with external rotation and abduction, but also elbow flexion, wrist flexion, internal and external rotation, supination, pronation. And she's going to have a decreased reflex of brachioradialis of the C6. And she's going to have sensation loss in her lateral forearm and her lateral hand as well.